Minister of Health, Sylvia Jones, as well as Minister Neil Lumsden at Mohawk College here at McMaster. This is a brilliant example of the investments we're making to get back to basics and emphasize hands-on learning, life and job skills that lead young Ontarians to good jobs in careers that are so necessary and where they can make a difference, be it PSWs or nurses or paramedics. Our government has expanded co-op learning, hands-on learning, as well as skilled trades education in this classroom. We think it's foundational, not just to fill the labor market shortages, but to ensure young people graduate with good paying jobs. That is the mission we're on. And so today, in addition to expanding those programs, we're proud to announce a $3.3 million investment to expand this type of hands-on learning for the dual credit program, which allows students to take a course in high school and it counts towards their college completion. It's a 2-for-1 initiative that accelerates their path into these meaningful in-demand careers. We're very proud of the work our young people are doing as they get on pathways to good careers, particularly in STEM disciplines. We're really emphasizing science and technology, engineering and math as the way forward for the jobs of the future. So we're grateful for the partnership at Mohawk, with partnerships right across Ontario working with Sylvia Jones, Neil Lumsden, and really partners across government as we open up doors to good jobs and meaningful opportunities within healthcare to fill those shortages and to support our families and our aging population. So this is a really positive step forward for young people, and it could have been done in partnership with our school boards and our local post-secondary institutions. So we're just very proud to announce this investment, expand opportunities for upwards of 6,000 students on healthcare will be benefiting from this healthcare pathway alone. And I know the Minister of Health is very eager for these students to graduate and get into our hospitals or our long-term care centers and other places that are going to make a big difference for the quality of life of Ontarians in all communities.
So what kind of interest have you seen so far with the high school students?
Well, we just spoke to many students who expressed a great deal of enjoyment of the program. They love the hands-on nature of it. It blends that theory with practicum, and really it's giving them the confidence, in addition to the core competencies, to succeed and to really keep rising. The program we were at helped bridge it was a bridging program for PSWs entering into nursing. These students are motivated, they are energetic, and they're highly intelligent. So we have total confidence they're going to get a good job upon their completion. And frankly, they're learning the requisite skills today to make sure they're successful tomorrow. Sylvia, do you have anything you want to add?
The only thing I would add is Wendy gave us an opportunity, as Stephen mentioned, to talk to some of the students who are currently working as PSWs in hospital settings and community settings, and they're taking advantage of a program to allow them to become practical nurses. So they're already working in those clinical settings. They see other clinicians and they want to do that work. So I'm very excited about it. One of the benefits of being here less than a year ago, of course, opening the MRI partnership. Our government since 2018 has announced 49 additional MRIs that will be operating within our hospitals across Ontario, and having a pathway to train those lab techs is really going to be an important piece of that MRI expansion. So,
is there anything specific that you've heard from these students that you can sort of share with us?
So one of the stories that was shared when I said, why are you choosing this opportunity, this laddering, was they saw, and working with nurses and other healthcare practitioners, they felt that they could do the job and they wanted to stay in the healthcare system, and so this is an opportunity for them to get that additional skill training to be able to continue to be a valuable part of a multidisciplinary team, whether it's in community, in hospital, or in our long-term care homes.
Here in Hamilton, just to switch gears slightly, measles, first outbreak, or first case with a child here in Hamilton. If I can get both of your opinion on this in both questions. Do you think, I guess with kids off on March break right now, coming back next week, are you concerned there's going to be more outbreaks perhaps in schools, and do you think there should be a specific vaccination program in schools?
So we have, for a number of years, been very focused and asking local public health units to refocus their efforts, particularly as it relates to childhood vaccinations, because there was a bit of a lag. So that work is ongoing. Of course, the Chief Medical Officer of Health in February issued a directive, a memo to all local public health units, reinforcing that they need to focus on childhood vaccinations, and of course, whenever there is travel, many of the cases have been linked to travel, so there was, again, that encouragement last week, earlier in March, to remind parents, caregivers, practitioners that you need to make sure that your vaccinations are up to date. We do have sufficient supply. We've actually procured additional vaccines if needed. And again, I would ask, have those conversations with your public health unit, with your local practitioner, to make sure that your vaccinations for your children and your loved ones are up to date.
Is that something schools might be watching out for next week as kids come back from holidays? Like the signs, the symptoms?
The Minister of Health sort of answered the question. Public Health is leading this, and we support their actions.
Will you be stepping up enforcement of vaccination rules when it comes to the measles and suspending more students who are behind or haven't provided proof of vaccination?
Those are decisions ultimately of public health. They provide guidance to school boards, and obviously the Minister of Health has encouraged families to take action to prevent risks to their children and to our communities.
So that is an ongoing program that all the local public health units do, issuing those letters, reminding parents, caregivers that they do not have up-to-date vaccination numbers. It could be a case where it just hasn't been included with the public health unit, but those letters go out all of the time. And when there are outbreaks, obviously it makes it that more critical for people to be staying on top of their vaccinations, particularly childhood vaccinations.
On that note, what is your ministry doing anything above and beyond what's normal to stop an outbreak like the one we're seeing in Montreal?
So, as I mentioned, we have procured additional vaccines, measles vaccines, if needed. So there should be no issue in terms of accessing vaccinations. The Chief Medical Officer of Health in February issued a directive to all 34 public health units, reminding them what we have said basically for the last 2 years, which is you need to focus and catch up on childhood vaccinations in particular. And when these outbreaks happen, I mean, Ontario, 15 million people, there are, I believe, the latest numbers are 8 cases, but still concerning. So we need to make sure that they have the resources, which they do, and that we're encouraging people to double check the vaccinations.
Are you getting any kind of sense from the general public because of the whole COVID pandemic that people think they can just snub all these other vaccines?
We're not getting any feedback like that from the public health units at this point. Obviously something to monitor. Look, measles can be a very, very serious illness, depending on your age and depending on the severity. So I would encourage people to have those conversations and make sure that their loved ones are protected. Thanks.
I just have another completely unrelated question for Minister. Okay. People have just a few weeks to book and take the GED test before that program ends. When will Ontario offer a replacement certificate, and what will that replacement be?
So the Canadian Ministers of Education have turned to Alberta to build out a new GET program. We've been in works with them to make sure that gets initiated. In fact, Ontario is taking an initiative in this respect to make sure that there's seamless completion. So there's more work to do on this for sure, but our mission is to make sure that any student, as they approach graduation, they've got all the skills necessary to be able to pursue higher learning, post-secondary, skilled trades, or employment. So just be assured that we'll be bringing forth an updated version that reflects the needs of the economy and obviously of our students.
I have a question for Minister Lecce as well. This is also not related to this, but one of the biggest crises we're seeing ongoing in Hamilton is the housing crisis, and there's a giant property downtown, Sir John A. Macdonald. It's we've been told that the school board says it's in the province's hands, it's in the Ministry of Education's hands to do something with that property. What can be done? Because we have many people right now who could be could be housed in a space like that. So I'm just wondering what the province is able to do.
Yeah, so we just passed a bill, Bill 98, the Better Schools and Student Outcomes Act, that was designed to better ensure the management of government assets. The taxpayer of Ontario paid for those schools. The school board then decided to close the school for whatever reason. It's been sitting empty. And we have many schools boards in Ontario that are sitting on either empty schools or empty parcels of land, and yet at the same time we have a need for long-term care and for affordable housing and attainable housing in Ontario. So we passed a bill designed to give the province new authorities. If school boards are not going to end the territorialism and the land hoarding, frankly, then the government now has powers to act to ensure that there's a public interest lens applied to a vacant parcel of land that hasn't been used for 5, 10, 20 years. Let's put it to good use for the public good. Be it long-term care, affordable housing. Let's work with our municipal partners. And, you know, we've been in touch with the mayor, and I know Neil Lumsden and others, and Donna Scully, have really encouraged governments to have authorities to force school boards to sell the school lands they do not need for educational purposes. So we built that law. We don't want to use it, but we're prepared to use it if we need to. We'll work with the school boards in Hamilton. I believe it's a public school board asset downtown with Hamilton Woodworth. We'll work with them to obviously ensure that that land can be unlocked, it can be sold to the market. The first obligation under the law, under our new legislation, is it would be offered to the coterminous boards, the Catholic board, French boards would have a first right of refusal. Then Infrastructure Ontario would be able to put their hand up if they want to build a long-term care or an affordable housing project. And if they say no, then it goes to the public market, and anyone could be the municipality or a local entity. So we're committed to making sure that those parcels of land are being used for the benefit of either education or some other public good. And obviously we're not going to permit billions of dollars of assets to be sitting when you rightfully point out that there are so many young people, new Canadians and others, that want to own an affordable home in this province.
Where are you in that whole process that you just laid out? Do you know with this specific property? Because I know you just passed that recently.
January.
Although the site, I think, raises a lot of frustration with residents because it's been sitting there for years now.
Yeah, no, I can appreciate why it is frustrating, and the school board will need to explain why they've held on to that asset for all these years. All I can simply say is we shared the frustration with the public. We passed the law. It came into effect January 1, and obviously we'll use the power when we need to. But we're trying to change the culture of school boards where they work together with their communities, where we don't have to go in, with a blunt instrument and force the sale. I'd rather them have a culture where they're doing what's right for their community. And that means if they're not using schools, they have no future enrollment projection that would suggest they need that school, they should sell it for another good in this community, be it affordable housing or long-term care. There's so many reasons why these assets, billions of dollars, like in Toronto for context, we're sitting there, that school board, one board of 72 is sitting on tens of billions of dollars of assets. So we agree it's unacceptable, so much so that we passed the law, and we'll use it where necessary. In the meantime, I hope the school boards are hearing us speak, where we want them to work together and sell off those schools that are not needed for educational purposes for the good of their community. Okay? Thank you.
Can we fake a little, you guys coming?